Payer policies have recently changed to address more specifically medical necessity for drug testing. They're focusing on individualized testing and proper utilization of drug test results. And basically what that means is no more of this test everything under the sun and do it every single time to line somebody's pockets, but instead do some more rational, patient-centered, balanced testing and then apply the results to the individual and use them in a timely fashion. Well, for example, in pain management, the payer policies, even the licensing boards, they're looking for things that make sense. You get a new patient in pain management, the doctor certainly needs to know and ask the question, what's in the patient's system before I give them an opioid, or if I'm considering that for their treatment. And so the doctor needs to think about what's really rational. What is in that patient's history? What's in the region or area as a common drug of abuse? And do we really need to add on some of these synthetic tests that even change because the synthetic drugs change so much? Is that really necessary, or is that something just being done to CYA or to line somebody's pocket? So those are like real basic for pain management. Flip it over to the addiction side with a new patient, they're going to have a different story. They may need to test for some of those drugs, but they don't necessarily need to test for them every time. So when somebody comes in new, the test may look different than when somebody's being monitored, whether it's pain management or addiction. Timely utilization means, is the provider getting the drug test results on time and in a fashion where they can do something that might need to be done with the patient? So for example, if a provider waits and only looks at drug test results just prior to the patient's next visit, they may be missing a lot of information in that 30, 60, even 90-day time span. In fact, they could be missing positive heroines, things that could indicate the patient really has a problem, and that can lead to trouble if a licensing board has to investigate an overdose death. And that's what, primarily the issue is there. The government goes and looks, are you really using these results in a timely fashion to affect the care of the patient? Are you making good, reasonably prudent decisions? And if they see a pattern of the doctor not using those drug test results in a timely fashion, that can lead to trouble because the medical expert's going to examine that to see if the prescribing led to the patient's death.